welcome to Evergreen. I'm Ted Brown. I'm a physician at the MS Center. We also want to thank the National MS Society for their sponsorship and our two sponsors from pharmacy. It's Corda Therapeutics and Teva Neuroscience. First, I'd like to start by introducing Kathy and Gretchen, who are ambassadors from the National MS Society.
My name is Kathy, and I am a daughter of an MS person. My mother passed many, many years ago, and she had MS before they had all of the medications and treatments that you have now. So sometimes I cry. So the MS Society is here to support you, every one of you. We offer ways to connect with the others, access information, get education, and then you can give back through volunteering or joining special events. Is anyone here part of the self-help group? Look at that. That's awesome. I'm going to let Gretchen talk about that. See, I just looked at it.
So, hi, I'm Gretchen, and I have MS as well. So, welcome to, there's so many of you guys. And luckily, we have air conditioning in here, so we'll all be cool. There are a lot of self-help groups that are ran through the MS Society. And then I also saw some people here that through MS Helping Hands and the donor closet, they have support groups. So just so you know, if you're ever interested in the self-help group, you can find it on the website for the National MS Society. But we also have them in Bothell, Kirkland, Redmond, and chapter-wide telephone groups. Issaquah. And I know there's one in Edmonds that's through MS Helping Hands. So we encourage you to come. When I first got MS, I went to one, it freaked me out. But I wasn't in a chair then, so how could I ever be in a chair or anything like that? And I now get a lot out of going to an MS Help support group, and really they're very upbeat. So I think that for me was just kind of, I probably rushed into things too quickly. So you're welcome. We're very glad you're here, and we have lots of good information from Dr. Brown and his friends.
And other speakers.
Sorry.
So, has anyone ever called the National MS Helpline? It's called the number is 1-800-5MS. Good. Hope you got good results there. So, this is what happens. All right, I need to find, where's a good place? Right there. Huh? Okay, don't move my head, don't move the microphone. So, when you call in, you'll talk to an MS navigator, and they are trained in social work and have knowledge and experience in MS. No question is too big or too small. If they don't know the answer, they'll find someone. They can connect you to any of the resources available through the society and through other organizations. If you don't know what you need, like how to work an iPad, they'll help you identify it and help research options. We're here, the National MS Society is here to empower you to make informed decisions. So please call and contact us. Doctor?
Okay, so with that, I also wanted to just introduce Pat Morgan. I think she might be out front, but she is our nurse. She's here this morning, and we appreciate her help in organizing this today. So this is Evergreen. This is where our MS Center is in Evergreen. We're on the 3rd floor there. And we have a comprehensive MS Center with rehabilitation services, research, and we have free parking as well. Hopefully you all got free parking this morning.
Yes.
And my colleague is Dr. Virginia Simnad, my partner in crime there at Evergreen. There's Pat Morgan. In the back there, she's our wonderful nurse. And Lori Friedman is our medical social worker, who in the past has been supported by the National Society for her services. So just to mention about our research, we're actively doing research and we are actively enrolling for studies right now. The studies that we're enrolling for include a study of bone density in multiple sclerosis, where we're just monitoring what happens to bone density over time. We're doing that by doing DEXA scans. So this study does not require taking a medication to participate, and it's a 2-year study. We're also doing a study to reduce injection site pain for people who are using one of the injectable medications, one of the new ones called Pledman. It's an interferon. We have a study to improve bladder control for people with overactive bladders, involving a wellness approach with pelvic floor exercises and education, and a medication involved, which is approved in general use for overactive bladder, but hasn't been studied in MS. We have a couple of MS drug trials where they're drugs that are designed to alter the course of the disease. And we can provide more information about that. And then we have a new study of a long-acting version of amantadine, which is often used for fatigue, and it's being studied to see if it alters walking ability for people with MS. So if you're interested in any of those, we do have some flyers up front, and you could call our clinic for more information. All right, well, nutrition is of growing interest, and the United States seems particularly interested in MS and nutrition. I did some searches using Google just to see where people are searching for information about MS and nutrition, and the U.S. comes up very high. And over time, it seems like that trend is increasing. Certainly, personally, when I was an MS fellow back in 2003, 2004, thinking over the year, there were a couple of discussions with patients about vitamin D. That was just coming in as vitamin D deficiency was being recognized as a risk factor for MS. And then I remember one patient who was very adamant about blueberries and was telling me that he was eating a pound of blueberries every day because he had read somewhere that would help close the blood-brain barrier. You know, it might have great antioxidant properties, and his skin color was not blue at the point of the slide. But so there was very little, really, at that time about nutrition, and now it's almost a part of every conversation. It really should be part of our routine clinic follow-up to discuss nutrition. What's holding us back to some extent is that there's still not that much known about MS and nutrition. We're still learning it. So hopefully today we can bring you some of the recent thoughts from Dr. Vijay Sri Yadav, who's our keynote speaker, and then Jennifer Adler, who I'll introduce later, is a nutritionist who works locally and has some very interesting ideas about healthy nutrition. I'm going to talk briefly about cardiovascular wellness in MS, just because I think that there is a sort of link between cardiovascular wellness and nutrition and MS. So people with MS are at risk for sedentary lifestyles. They tend to have more disability, and they tend to have a lot of health issues that keeps them from exercising as much as the general population. They also have some risk for heart disease. They have a prevalence of hypertension, at least 10%, same with hyperlipidemia, and obesity is rated about 24% in MS. And that's about the same as the U.S. population. It varies from state to state, and we tend to be one of the leaner states here in Washington, but it's still a problem. And all of these rates go up with increasing age. Heart risk factors and the risk for mild cognitive impairment. So this slide is not talking about in MS. This is talking about in an otherwise healthy population as they age, and it's specifically done in females, but you find that with dementia, hyperlipidemia, hypertension, or smoking, the risk of having cognitive problems, and that's expressed as a hazard ratio there, which means the risk is basically increased. So 1.3 would mean about a 30% higher risk than if you didn't have diabetes. Okay, and you can see that smokers really have the highest risk. And then if you had multiple risk factors, the risk would be compounded.
Can I ask you to explain what hyperlipidemia is?
Well, that's high cholesterol.
Okay.
Basically, hypertriglyceridemia. MS and heart disease. So people with MS do get heart attacks. I think that it's fairly similar rate of risk to what we see in the general population, but some studies have shown an increased risk of dying from heart disease. If you have MS and heart disease, you have an increased risk for reliance on pain for walking, for visual problems, and brain atrophy. And Dr. Yadav will come back to this same work by Ruth Ann Marie. High cholesterol and MS. So lipids are key constituents of myelin. You know, we talk about white matter. Well, white matter in the brain is white because it contains fat, and the fat, that's lipids, that's in myelin. Okay, so we need myelin to have a healthy nervous system. We need lipids. HDL, sometimes called the good cholesterol, and LDL cholesterol are involved in lipid transport. HDL may have an antioxidant role at the blood-brain barrier. That's the BBB, blood-brain barrier, where we don't know about blueberries, but HDL might have benefit. High HDL has been associated with lower volume of gadolinium-enhancing lesions. That's a good thing, but we don't want gadolinium-enhancing lesions in MS. On the other hand, high LDL and total cholesterol have been associated with higher baseline disability and worsening disability over time in MS. MS and obesity. As I said, obesity is reported to affect about 24% of people in North America with MS. Teenage obesity has been associated in several studies now as an MS risk factor and predicting an earlier onset of MS if there's teenage obesity. More so in females than in males. Females with body mass index of more than 27 as a body mass index were in one study found to be at twice the MS risk of those at less than 27. So that means the risk of developing MS. Okay? And then higher baseline body mass index may predict a more progressive MS course. And Dr. Yadav will come back to this as well. Why might there be a link between obesity and MS? Well, obesity and other cardiovascular risk factors may affect certain hormones that interact with the immune system in ways that are harmful to MS. Adipose tissue can produce hormones, hundreds of hormones, peptides, cytokines, collectively referred to as adipokines. And some may be pro-inflammatory, and this includes leptin, which you might hear more about in the years to come. Leptin does cross the blood-brain barrier, so it's a adipokine that may have pro-inflammatory effects, which in MS, that's bad. You don't want that. And mice with leptin deficiency, so they're not producing leptin normally, are resistant to the experimental model of MS, where you try to induce inflammation in the central nervous system. And it's harder to do in mice who don't have the normal response to leptin. What about calorie restriction in humans in MS? There is a study going on. It's at Washington University, which is in St. Louis. It's not here at our University of Washington. Calorie restriction has been found to have benefit on the experimental version of MS in mice, but it's easier to calorie restrict a mouse than it is a person. And in this controlled study, what they're doing is interval fasting. So the subjects will fast 2 days per week, and it's I believe a 2-year study, and that's the intervention. These people are off of disease-modifying drugs, and they're using fasting, this interval fasting. So we'll have to wait and see what results are achieved from that study. Cholesterol lowering in MS. So I'll just say HMG-CoA reductase, because the whole thing is a mouthful. Reductase inhibitors. These are statins. They're drugs that are commonly used to lower cholesterol. And there have been now a number of studies done in multiple sclerosis with statin drugs. The most impressive one has been done in secondary progressive MS, which was a randomized controlled trial of a high dose of simvastatin. That's one of the statin drugs. And that study found a 43% reduction in brain atrophy over 2 years in secondary progressive MS. So that was quite impressive, but needs to be reproduced. They also found secondary benefits in measures of disability progression and symptom impact. So we really need more work like that to confirm those results and perhaps look at other ways that that statin drugs and other novel approaches might be helpful in progressive MS. How about exercise? Okay, we know from studies in healthy populations that exercise can improve lipid profiles. Okay, well in MS, the same sorts of studies have been done of exercise, and we see some short-term effects that triglycerides, total cholesterol, and VLDL cholesterol and body fat percentage are all reduced. And short-term means just a couple of months. That's all it takes to see those effects on cholesterol levels. And this is done in MS. These are MS exercise trials. And the long-term benefits, if some studies have looked at more like 6 months and on, we can see that LDL cholesterol comes down, HDL cholesterol goes up, which is what we want, and then body weight and body mass index can be reduced with exercise. There was a study that was just published this year. It was done at the Seattle VA by Aaron Turner. He's actually a psychologist and his colleagues. This was a 15-year mortality study done with veterans who have MS. They studied almost 3,000 veterans, and they found over 15 years that about half died during that time. They found that a higher level of baseline physical activity was associated with lower mortality. And there was a dose-dependent effect. So if someone exercised once or twice a week, their risk was reduced from being 1 to 0.64. If they exercised at least 3 times a week, then their risk was reduced even more of dying from all causes. A few key points about exercise in MS. We want to have people trying to combine exercise with dieting as a more effective way of controlling their weight back to their optimal weight. The right exercise program is the one that will work for you and that will be sustained and be part of your lifestyle, because its long-term effects of exercise are really beneficial. So make sure you get a good program. If it doesn't feel right for you, if you don't enjoy it, then it's probably not the right program, because it needs to be something that's sustainable for you. And we want people to set goals for their exercise program. That tends to be motivating and kind of reinforcing and fun too. Like we at Evergreen, the employees, I think Pat was involved in this, we just did this thing where we tracked our exercise for 3 months or something, and we were supposed to see if we could make it to the top of Mount Rainier by just, how many steps a day we did. I didn't get altitude sickness or sunburn or anything. I think we got a free t-shirt.
Yes.
Right? So set goals to track. I think using some sort of an activity monitor to measure your steps per day, or just writing down on a calendar your workout routine over time really works out. And then think about the role of a physical therapist. Physical therapists can give an exercise program like a fitness trainer, but they understand spasticity and balance issues and might have a more fine-tuned and targeted exercise program than you would get from just starting it on your own or going to a fitness trainer. Also, talk to your MS care provider, because they can steer you to the right people, and they might have some good ideas as well. So as a final message from me, I'll just say we're still learning about nutrition. Hopefully we'll all pick up some good ideas today. But in general, if it's good for your heart, it's probably good for MS. That seems to be what we're learning. So when you hear about nutritional interventions that might be good for your heart, think that's probably going to be something that's good for managing MS as well. There was an interesting paper from the American Psychiatry Association that I just read, where they were talking about nutrition in psychiatry. It was really interesting that doctors were using nutritional changes to try to treat depression and other psychiatric problems. And the speaker said, try to eat the rainbow, try to have different colors of food. Greens and oranges and blues and purples means that you're getting a lot of different nutrients that you might not get if everything is beige, kind of a pizza color. So I'm trying to follow the same thing, encouraging my family to do the same thing. Here's my son. He's the one with his mouth open, which is fitting, I guess. Red, white, and blue popsicle. Thank you very much.